Hey everybody, this is Dr. Jason Scoppa coming to you from our office in Bellevue, Washington. Today we're going to be talking about the 6 most common causes of TMJ pain. So the TMJ or jaw pain, we see a lot of these patients. A lot of our practice is focused on the TMJ and patients suffering from TMJ pain and dysfunction. This kind of goes along with another specialty in our practice, which is hypermobility. Not all patients with TMJ pain have hypermobility, but that's a common thing that we see, that correlation between the two. TMJ pain is really poorly understood. It's misdiagnosed. It's kind of the Wild West in terms of treatments. And if you go to 10 different people, you're going to get 10 different opinions about what's wrong, what needs to be done. And kind of ironically, nobody gets any real TMJ education in school. So not dentists, not chiropractors, not PTs, other than basic anatomy. That's it. So anybody who really understands and treats a lot of TMJ issues, they've had to go out of their way to really specialize in that area. Even, everybody has it on their website, every PT, every chiropractor, every dentist. But very few people actually understand it or diagnose it. They all kind of have one thing they throw at it and then kind of cross their fingers. Like the chiropractor will adjust your neck, kind of cross their fingers. The dentist will throw a night guard in, cross their fingers. PT will give you some stretches and exercises and cross their fingers, but there's no diagnosis of the problem. And this is the key point, I think, is getting the right diagnosis and working with somebody that really understands what's going on. It's not a one size fits all kind of thing. It depends on what your goals are, but also what's going on within your body. What's the diagnosis? How can you treat without a diagnosis? But this video is about the 6 most common causes of TMJ pain, which we're going to get into now in a decent amount of detail. So number 1 is disc derangement. So the jaw joint, I have my skull here to help us. So the jaw opens not quite like this. This is just a model. So in this model, the jaw is just pivoting. The mandible is pivoting on the disc like this. But in reality, what happens, there's something called a rotation phase and a translation phase. So the first phase of opening is called rotation. So the condyle spins on the disc, and that's the first small degree of opening. And then it rides the disc forward. So the disc isn't just stuck in the head like this. The condyle rides the disc forward, and that's how you get the rest of your opening. And so in a situation called disc derangement, just as it sounds, the condyle is not sitting in the middle of the disc. It's usually it's behind the disc, but it can also be in front of the disc. And on one side can be behind, one side could be in front, or both can be back, or both can be in the front. So it just depends on what the situation is. But so oftentimes patients that have disc derangement will have a lot of popping and clicking in their jaw when they open. It clunks this way or that way, or it'll go to one side or another side. And so this is called disc derangement. And there's different ways you would manage that. It's a little too much to get into in this video, but the TMJ discs is a big cause of TMJ pain, because there's a lot of nerve tissue, especially behind the TMJ disc. It's called the retrodiscal tissue. So if the mandible is jamming back into that retrodiscal tissue, it's going to cause a lot of pain. And also if it's opening asymmetrically or closing asymmetrically, it's going to cause a lot of asymmetrical muscle tension and things within the jaw and the head and the neck. That's also going to cause pain. So that's a big problem. The next cause of TMJ pain are bite problems. So bite problems, your teeth are supposed to align in a certain way where the top teeth slightly overlap the bottom teeth, and it goes that way all the way around, and the teeth are supposed to fit kind of nicely into each other. So bite problems are where that doesn't happen. So it's either off to the side like that, or it's forward or this way. It can be in any plane, but essentially your bite doesn't line up. And I'm going to go ahead and throw into this grinding, clenching, this kind of thing, because grinding and clenching of your teeth can cause bite problems by wearing down the teeth and causing issues that way. So Um, all of these, and that'll get muscles firing that aren't supposed to be firing. If you're grinding, clenching all night, you could be seen the best person in the world, but at night you're going to undo all the work that was done. So, bite problems are a major issue because, let's say, for example, your maxilla, so your midface here, this bone has a slight tilt down on the left side, on my left side. So as a result, your teeth are going to be hitting harder on this left side than they are on the right because you're tilted a little bit. So well-intentioned, but a lot of orthodontists or dentists will shave the teeth down on that side. And now that, oh, look, your bite's perfect, it's even. But what they've done is locked you into that dysfunctional bite pattern to where now you can have somebody kind of lift this up, but then by the time you go eat lunch and your teeth come together, it's going to lock you back in to that dysfunctional pattern. So bite problems are a major cause of TMJ pain. Number 3 is maxillary underdevelopment. So we were just talking about the maxilla. So this is the maxilla here. So it's where our upper teeth fit in. We have our maxillary sinuses, our nose. This is all part of the maxilla. So the maxilla, along with the zygoma out on the side, make up what's called our midface. So our midface in modern humans has become a major issue where this is underdeveloped. So the midface develops as a result of, goes into our next topic somewhat, but in terms of tongue function. So when you're a baby, the tongue on the roof of your mouth is what expands this maxilla forward and lateral. That makes room for your dental arch as well as your maxillary sinuses. So if that doesn't happen, and also chewing we don't chew hard food anymore, especially when we're younger and we're developing and our craniofacial system is developing. This bone can be underdeveloped, which causes a lot of crowding in the teeth, but it also can cause airway issues, and it can cause TMJ problems because the lower jaw, the mandible, follows what's going on in the maxilla to try to keep a neutral bite, like we talked about before. The jaw is going to be, if this is underdeveloped, the jaw is going to be pinned back to get your teeth to align correctly. So when the jaw's pinned back like that, or sometimes it happens through orthodontia, they'll actually jam this back, which can cause it pins the jaw back, and it can cause a lot of TMJ problems. So there are things you can do about that, even as an adult. I said it's too much for this video, but all of these things have solutions. It's just, who to work with and which one needs to maybe take precedent. Maybe multiple ones are a problem. A lot of it's about getting the right diagnosis. So number 4, tongue dysfunction. We just mentioned it. When you're not speaking or eating, your tongue should be suctioned up to the roof of your mouth. And so that in doing that, a few things happen. So you're going to have a lip seal, breathing through your nose, tongue's up on the roof of the mouth. So it's going to create more nitric oxide in your blood and help bring you into more of a parasympathetic, less sympathetic tone in your body, which is good. That's how you heal, is in a parasympathetic state when your nose breathing. But the tongue on the roof of the mouth also guides the jaw down and forward. If my tongue's on the bottom of my mouth and my mouth's open, the jaw ends up coming back like this because the tongue is down. When the tongue comes up, it pulls the jaw down and forward. So it's decompressing the jaw joint when the tongue's up. So tongue position can be really important. Now, some people have a tongue tie where they literally cannot get their tongue up like that. But if you can, that's where you want your tongue to be. And there's training that you can do and things you can do to help. Assuming the tongue can move well enough, then it's just about training it to get there. And that's when you're at nighttime as well. You want your tongue up on the roof of the mouth, and you want your lips together when you're not speaking or eating. So tongue dysfunction is another cause of TMJ pain. And you can actually get the disc arrangement. Sometimes you can get the jaw to recapture if you can get the tongue moving correctly. Because of what we just said, it guides the jaw down and forward. You can sometimes recapture those discs. The 5th thing we're going to look at, the 5th most common cause of TMJ pain, are ascending influences. So by that, I mean ascending influences. So anything that's coming from even the feet. There's a few studies done in Japan where they took people with equal leg length, no jaw pain, and they induced a short leg on those people. So they put a heel lift in one side to give them a short leg, and they started biting harder on the side of the short leg and started getting jaw pain on that side. So even if as far away as leg length, we know pelvic torsion can affect condyle position in the bite. We know SI joint dysfunction, which we get into a lot in our office. Specifically, a hypermobile SI joint can affect TMJ and bite occlusion, as well as cervical spine misalignments like C1, C2, and all the way down the neck. Misalignments there can affect the jaw and the teeth. And then leading into our sixth thing, cranial dysfunction. So the dura, which is the covering of the brain and spinal cord, has connections within the cranium itself. And so that will be pulling, if it's pulling asymmetrically over time, it's going to create strain within the cranium itself. The jaw attaches into the skull. The TMJ is the mandible and the temporal bone. So if there's a lot of strain within the temporal bone, or as I said before, if this midface, if it's really underdeveloped, it's going to cause the TMJ to sit in an awkward position or an asymmetrical position. And over time, it's going to create increased stress and wear on the TM joint. So having somebody that understands cranial dynamics and cranial dysfunction, it's an important part of this process. So, what's causing your TMJ pain? It could be one of these, it could be all of these, it could be a combination of these, but ultimately these are usually what need to be addressed in order to fix the TMJ pain and dysfunction. And finding somebody to work with can be challenging, but I would ask questions at what percentage of your patient population comes in with TMJ pain? So how often are they seeing this problem? Who do you work with? What are your protocols for working on patients that have this? Most cases of TMJ pain do best with a multidisciplinary holistic approach. So I often am working with dentists, with orthodontists. It really just depends on the goals of the patient and then what's going on. What's the diagnosis? So I might tell a patient, hey, you need full mouth reconstruction. You need to increase the size of the maxilla. You need to have the jaw brought down and forward. You need to remodel the jaw, all these things. But the patient's like, I don't have the money. I don't have the time. Whatever the reason might be, that's not going to work for me. Okay, then, we meet them where they are, and it's not apples to apples. We kind of explain, okay, this is another treatment scenario, and this is what you're giving up by doing this, but this is maybe what you're gaining, whether it's, it's cheaper or more time or whatever else. So it's just working with people where they are and trying to find somebody that understands what you want, but also can give you the correct diagnosis to your problem. Because these can be very expensive treatments that people get into for these. And it's a shame, when they come out of it and they don't get what they want out of the treatment. So I think being clear about what you want and being clear about what you need are the most important pieces. So I hope this was helpful. As I said, 6 most common causes of TMJ pain and dysfunction. Check back for more information. We do in-person treatments for this, I said, and diagnosis for this. We do Zoom consults where we can diagnose and compare. If you've gotten 6 different treatment plans, we can kind of compare them with you, pros and cons, and go over, what's going on and which one might be the best fit for you, this kind of thing. But ultimately, like I said, it's good to find somebody local to work with. So hope that's helpful, and leave comments, questions for us, and we'll get to them when we can. Thanks for watching.